Hi YouTubers, this is Arnold Solof with another COVID-19 update dated March 23rd, 2020. Today I want to talk about exceptions, temporary exceptions to the HIPAA Privacy Act. HIPAA stands for the Health Insurance Portability and Accountability Act, and basically that's to guarantee that information that should remain private is private, and if you violate this you can be sued. When the COVID-19 outbreak hit and the drive to provide care under telemedicine occurred, many of us, probably most providers, were not set up for telemedicine. Our practice is contracting with a provider called Chiron to set this up formally, but they're deluged with requests to set up new accounts, and we don't know how long it'll be before we can set it up. So my thought was, well, in the meantime, why don't we just use something like Skype, Apple FaceTime, Facebook Messenger, whatever other video apps, in order to provide video conferencing and provide our virtual visits in that way until we can get the more formal setup working. Well, most of these other setups are not HIPAA compliant. So if we were to use them, we would be liable for violation of the HIPAA Privacy Act. But then I thought, well, heck, during this outbreak, they should make an exception. And I did a search on Google and immediately found that they actually have done this, but I was unaware of it, and I'm suspecting, given how much hustling we've been doing to try to get this thing set up, that most other providers are unaware of this as well. So Skype is now okay, and at least during the COVID-19 outbreak. Apple FaceTime's okay, etc. And other similar, Zoom and other similar video conferencing apps are okay to use during this outbreak. So I'll post the links to the information documenting that it's okay to use these apps, but I'm just going to read to you briefly some of the highlights of what they said. So it says OCR, which stands for the Office for Civil Rights at the U.S. Department of Health and Human Services, announced effective immediately, and this was on March 17th, 2020, that it will exercise its enforcement discretion and will waive potential penalties for HIPAA violations against healthcare providers that serve patients through everyday communication technologies during the COVID-19 nationwide public health emergency. So it goes on in more detail, and again, you can go to the link to read it, but if you go there, it specifically lists these applications, what's okay and what's not okay. So they specifically say Apple FaceTime, Facebook Messenger video chat, Google Hangouts video, or Skype. They specifically name these apps. And I assume the same thing will apply to comparable apps. However, anything that's public facing you can't use. Now, why the hell you would ever want to do that is beyond me, but for example, if you were to use live streaming video to a public audience, such as using a live YouTube stream or a live Facebook stream, as if you were giving a public lecture or talk or conference, whatever, to a group. You can't be conducting a visit, providing health care to an individual patient while you're publicly transmitting the video. But again, who the heck would ever do that? So again, just want to emphasize that, and this is an alert to all healthcare providers out there and people who want to get healthcare. Let your doctors know that, hey, it's okay to use Skype. They're not going to get sued during the COVID-19 outbreak if they do it. So again, this is ends this COVID-19 update for March 23rd. Thanks for watching.